What's up, friends? My name is Steven Stearns. I'm a student physical therapist at South College in the January class of 2021. Today, we're here to talk about some knee flexion extension graded mobilizations, as well as a talocrural joint distraction manipulation. So first things first, we need to review our convex-concave rules. So as we know, this is going to depend on which segment is moving, and that's going to depend on open versus closed chain kinetic movement. So if we have a concave surface moving on a stationary convex surface, the roll and glide are going to occur in the same direction. Whereas if we have a convex surface moving on a stationary concave surface, the roll and glide are going to be in the opposite direction. It's important as we talk about the knee because we have the femur, which is a convex surface, and the tibia, which is a concave surface. So we need to keep those rules in mind as we go through our manipulations. Another distinction we need to make is between accessory and physiologic motion. Accessory motion is what we think of as arthrokinematics. That's going to be our roll and our glide. It's motion that's involuntary and that we can't control. Our physiologic motions are what we think of when we typically think of joint motions. Those are our osteokinematics, such as flexion extension, and they're created by the muscles. All right, so first things first, we're going to perform some physiological knee extension mobilizations on our patient Jessi here. So we're going to be mobilizing this right leg. Just for the sake of the camera, we need to be able to see what's going on. So we're going to prop our distal leg up on the table and put her ankle right on that thigh. What we're then going to do is get our hands, thenar eminences, right on the tibial plateaus there. We need to be below the joint line, and we're going to want to push in the direction parallel with that joint line. That way we are creating motion of the bones, right? So we're going to come here and just push down, and we're going to use that for our grade 1 through 3 mobilizations. If we want to get a little bit more in depth and get a grade 4, we're still going to keep that leg propped up. We're going to go fingers towards the toes this time. Thenar and hypothenar eminences again on that tibial plateau, making sure that we're pushing parallel to the joint line, actually creating motion and not just pressing on our patient's knee. So what we're going to do is it's going to be a simultaneous push down with this hand and a pull up with this distal hand. So we're really going to ratchet that guy into extension for a grade 4. So we're going to get to R2 and then just hover in there. All right, so next what we're going to do is a posterior to anterior glide. This is going to be knee extension accessory motion. So we're really trying to facilitate that tibial glide forward. So what we're going to do is we're going to grab down here on the front of the ankle, and with our hand we're going to cup in a C formation on the back of the knee here. Again, making sure that we're below the joint line. We actually want to be pressing, making sure that we're creating motion here, taking care not to press on any of the sensitive structures in that popliteal fossa. So we're going to go ahead and get in position. And it's just going to be a downward graded mobilization with this front hand. So remember, we're going to sink. We're not going to push. We're going to sink. So elbow in tight to your body. Go ahead and get in here. And then we can hit our grades 3 and 4 mobilizations there with our accessory motion for knee extension. All right, so now that we've got knee extension taken care of, we need to look at knee flexion. So we've got our patient supine here. We're going to mobilize this right leg again. So for an initial knee flexion physiologic motion, all we're going to be trying to do is creating more knee flexion. So we're going to bring this foot up off the ground. We're going to palpate here at the joint line, and we're just going to come down to the anterior distal ankle, and we're going to push that heel in towards her thigh. And we're just going to try to get that nice motion through there, and we can use this for grades 1 through 3 mobilizations. All right, so now that we've addressed knee flexion physiological motion, we're going to address our accessory motion. So what we're going to do is we're going to have our patient bend their knee up, foot planted firmly on the table, and we're going to come in, we're going to straddle the knee just to make sure that everything stays in place. We want to make sure that foot doesn't slide. We're going to take our thenar eminences on the respective tibial plateau, and our joint line, if we think about it, is going to be in this angle, in line with the plane of the femur. So that's our direction that we need to push. So we're going to be here, and just lean in and give nice grades 1 through 4 mobilizations. If we need to get a bit more aggressive with a grade 4, what we can do is bring our patient here, and then if we think our joint line again is going to be in the plane of this femur, so again hands on the tibial plateau, and we're just going to lean down. This just allows you to get some more body weight and some more force into that joint and really get the tibia moving. All right, so next we are going to move down to our talocrural joint. We're going to do a distraction manipulation. So we would use this if our patient has limited dorsiflexion range of motion. So first, we know that the ankle joint is a complex, right? There are several joints down there. We have the talocrural and the subtalar among many others. So we need to make sure that our talocrural joint is in its open pack position, which is plantar flexion, and that our subtalar joint is in its closed pack position, which is full supination. we really need to take up the slack in the subtalar joint so that we can isolate our movement to the talocrural joint. So Jessi, if you could scoot down to the edge of the mat for me. All right, so we're going to use this left foot as our example. So we're gonna lace our fingers as such and scoop the foot. We really want our pinkies right on that joint line. So we're gonna scoop, and I'm gonna have to raise this table up the wrong way, just so that I can keep good body mechanics. I don't wanna be rounded over trying to manipulate. That's just not good for longevity's sake. So once we get her up where we need to, this looks about good. So we're gonna lace our fingers again as mentioned, come here, and we're gonna go, I like to go thumbs on the bottom of the foot pointed towards the ceiling. So we're gonna push up, go into supination a little bit, and then from here, just distract. All right, so that manipulation, it's again just a scoop here and then a quick distraction thrust. So after we do that, we would reassess our patient's dorsiflexion range of motion, and if it's improved, we're gonna load those new ranges just to reinforce that and make changes that are going to last. Thank you for your time and attention. Have a great day.